Hi, it's Leanne here from Polite Pooches Sydney, and I'm with Dr. Tennille for our Friday at 5. And today we're going to talk about GDV.
GDV. Okay, so GDV is gastric dilation and volvulus, which is a big mouthful for bloat, really. So where the stomach blows up and it gets too overinflated, and then it can twist. So you can get just it blowing up, or in worst cases, the stomach actually twists, and it's a bad disease that we see in dogs.
And Dr. Tennille, with a dog that gets GDV, when for example their stomach does actually twist, what does that mean to the dog?
Yeah, it's very dangerous because basically you are decreasing the venous supply, so blood can't get in and out of the stomach. So that means that the whole cardiovascular system is compromised in the pet, and also the stomach can start to die because it doesn't have a proper blood supply anymore. And then the bacteria that are all in the gastrointestinal system can then translocate into the blood system, which is also very bad.
So in other words, if a dog does get bloat with a twist,
Yes.
and they're not attended to immediately by
Yes,
veterinary,
it's an emergency.
they can die.
That's right, for sure. There is a risk of death it's an emergency. You don't wait, you go straight to the vet with this condition.
So what would be the signs that people would look for if they
Sure.
suspect it?
So the signs are, well, you might notice that your dog's abdomen looks enlarged, and it almost feels like we call it like a drum. You know, like you tap on it, it's like boom, boom, boom. It's full of air. But also the dog may be hypersalivating, breathing more rapidly, heart rate's increased, retching, and they might be sort of in a lot of pain as well. So look like a hunched stance, and they go into shock basically. So their gums can look pale. They're not got a proper blood flow around the body anymore. So that's the signs you can see.
And what would be the risk factors for a dog getting GDV?
It's almost exclusively something we see in large and giant breeds. So the bigger breeds are a risk. The deep-chested breeds are a risk. So where we've got that really long thorax, the long narrow thorax. Also dogs who hoover their food, so eat their food really quickly. Dogs who have a more anxious, fearful, aggressive temperament, that's a risk factor. That's probably the most. It's really the breed, actually.
And what would be things that owners could do to help lessen?
Yes, to prevent.
Mm-hmm.
So if you've got a breed, like if we talk about the breeds which we see them with a GDV the most, by far Great Danes are the biggest risk breed, and German Shepherds are another one. But any of your deep-chested, large or giant breeds, so Weimaraners, Dobermans, that sort of thing, are a risk. And to prevent it, you want to try to encourage your dogs to eat slower. Don't give your dog one large meal per day. You're better off, particularly with these breeds, doing smaller meals, at least 2, or you could even do more if you wanted to. And most importantly, try not to exercise your dog straight after they eat or straight before they eat, so that they can digest their food better.
And is there a particular age where this is more prominent in dogs?
Not really. Like mostly it's adult dogs, but at any age is a risk. Treatment?
Thank you. Yes, treatment.
So if you think your dog may be suffering from this, some dogs are actually collapsed. You might find your dog can come on very suddenly and they can appear collapsed. You should go straight to your vet. If your vet's not open, you should go to an emergency centre. And generally what the vet will do initially is stabilise the patient, and that is where we usually pass a tube to try to bring the pressure down in the stomach to get the gas out and support the cardiovascular system. So they'll be going on a high rate of fluid therapy and deflating the stomach. So that's what we're doing, try to stabilize the cardiovascular system and deflate the stomach, and then what will need to occur is a surgery to, what we do is sort of attach the stomach to the side of the abdomen or chest, so that it can't twist. It's actually fixed there. So yeah, the surgery will need to come once the patient is stabilised. With that surgery, there's even now, particularly with Great Danes, is clients will ask me about having this procedure prophylactically, so done in case it happens. And this is something that you can, if you have one of the breeds that are at risk, then you can talk to your vet about having that procedure done. A common time is when they do it at the same time when they're desexed at 6 months.
So as someone who's lost one and thankfully had one saved through GDV, all I can say is please don't mess about with this. This is not a situation that you can think, oh, I'll wait until tomorrow. And luckily, thanks to the help that I received from the vets here and my knowledge of GDV, I managed to keep my king and not lose him because he was severe and his stomach had twisted top and bottom.
Yes, that's right. You want to emergency, get to your vet, and I mean sometimes we have to remove part of the stomach because it's already died by the time we go in there. So it is quite a dangerous condition. I think it's just about being educated really now that, you know, if people are aware that this condition can occur, then hopefully we can, you know, because you can't, some dogs, it will just happen. You do everything to try to prevent and it will just happen. There's nothing they've done wrong. And as long as you're aware of that and get treatment fast, then the prognosis will be good.
Okay, great. Thanks, Dr. Tennille. And this was a really informative and hopefully life-saving interview. I appreciate that.
Thank you.